me.
Welcome to the Senior Rehab Project,
The podcast for rehab clinicians that want to better serve older adults.
And now, your host, Dustin Jones.
Hello, folks. Thank you for the download. I figured you had not gotten enough of Zach Stearns, so I figured I'd play another awesome blog post that he wrote titled A Middle Way. If you didn't listen to last week's Senior Rehab Short, you missed out on the announcement that Zach Stearns, along with David Reed, are joining the team. They are joining the Senior Rehab Project with their podcast, the Voice of the Patient podcast. Zach is going to be leading that up, and David Reed is going to focus more on the writing/blogging side of things. But I'm very excited to have them on the team as they hold a very, very special place in this podcasting world, and that they are looking to the patient to see how they can inform our decisions and improve healthcare and our outcomes. So without further ado, here is Zach Stearns, University of Florida DPT student and host of the Voice of the Patient podcast, reading A Middle Way.
One day in PT school, one of my professors gave a strong case for why anatomical factors are less predictive of persistent pain than are psychological factors. My classmates were a bit speechless. I couldn't blame them. We just spent several months and an unbelievable amount of tuition money learning anatomy under our assumption that pain in a certain anatomical location is related to injury to a certain anatomical location. That day in class, it felt like the air was let out of the room. But I was thrilled. After class, I asked my professor a few questions about psychology and physical therapy. I wondered whether cognitive behavioral therapy was within our scope of practice as physical therapists. I questioned whether physical therapists are open to psychological interventions. I asked what psychological treatments look like in a physical therapy setting. He answered my questions graciously and told me that he had something that would probably interest me. He brought me to his office and showed me a special issue of the Physical Therapy Journal on psychologically informed practice. I was still thrilled, with my excitement getting increasingly geekier. I read every paper in the issue, word for word. That day altered the course of my training as a student. As I've said before, my background is in psychology. Over the course of several years, though, I drifted away from the field of clinical psychology and toward the field of physical therapy. I thought that I had moved to the other side of the planet as far as health professions are concerned. Finding out about an approach to physical therapy that embraces psychology tied my two primary academic interests together. In that special issue of PTJ, Chris Main and Stephen George elaborate on the definition of psychologically informed practice, or PIP for short. They write, PIP is offered as a middle way between narrowly focused standard physical therapist practice based on biomedical principles and the more cognitive behavioral approaches developed originally for the treatment of mental illness. The authors describe standard practice as having the primary goal of reducing symptoms, with the core philosophy of addressing physical impairments based on biomedical concepts. On the other end of the spectrum, mental health practice carries the primary goal of minimizing the impact of psychological disorder on quality of life, with the core philosophy of identifying and treating mental illness. Main and George suggest that the primary goal of psychologically informed practice is secondary prevention of disability, with the core philosophy of incorporating patients' beliefs and emotions into patient management based on a biopsychosocial approach. In simpler terms, standard practice cares about physical problems in order to reduce physical symptoms. Psychologically informed practice cares about physical problems and the psychosocial parts of their problem, And PIP aims to reduce the impact of a condition or injury even if the symptoms remain. A logical extension of this approach is that PIP may involve a physical therapist providing something like cognitive behavioral therapy in order to manage factors that contribute to the pain experience. For many physical therapists, awareness of the psychosocial component of pain is nothing new. In my experience, though, many PTs have never heard the term psychologically informed practice, and they have no intention to learn how to use psychological interventions. Unless they say that exercise is a psychological intervention, which appears partially true for some people, but probably not true for serious mental illness. Thus, there is likely a wide range of responses to PIP. I am particularly interested in those who are either students or fresh PTs. Do you feel confident in providing something like cognitive behavioral therapy? If not, then would you want to learn how to do it? From the many conversations I've had about PIP, it seems that the longer PT has been practicing, the less willing they are to provide PIP. I have no interest in trying to convince someone to take a specific view about PIP. Rather, I'm interested in working together to find out, 1, whether PIP is actually more effective than standard care, and 2, how to use PIP in a specific, repeatable way. So far, the answers to these questions are complicated. Every year, though, the research literature sheds more light on PIP. And in an upcoming post, I'll focus on a study published last year by 2 of my PT school professors, Jason Benachek and Stephen George.
Hit me. Thank you for listening to the Senior Rehab Podcast. If you enjoyed this episode, you should hop on over to seniorrehabproject.com to find more helpful content. You can also find out how you can join the team and be a part of the private Facebook group, the monthly mastermind meetup, and have a say in the content and direction of this podcast. Once again, that's seniorrehabproject.com. I appreciate you, and I'll talk with you soon. But in the meantime, do not forget to stay funky.